Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast with Richard Jacobs.
Before we begin, a note from our sponsor. I'm Richard Jacobs, Executive Director of the nonprofit Finding Genius Foundation and host of the Finding Genius Podcast. In late 2016, I was rear-ended at 65 miles an hour by a truck on the highway, which sent me off-road into a ditch. The impact of the collision gave me a concussion and other injuries. At the hospital, a CT scan showed that I had thyroid nodules, which turned out to be cancer. It was then, when I had a biopsy of my neck, that I realized even if I was a millionaire, I wouldn't want a second or a third biopsy due to the pain and the invasiveness of it. And appointments at that time for thyroid experts were 3 to 6 months out. And I was worried about dying now, even if that was irrational. So because of this, I've decided to raise money to conduct a literature review on steroids, on the causes of anxiety and depression, a condition that affects well over 50 million people in the United States and hundreds of millions worldwide. Our goal is to create a codex, a guide that reveals all possible treatments for anxiety and depression for people that live with the condition, or for loved ones that have it, as my wife and my son do. To find out more about our fundraiser, visit findinggeniusfoundation.org and click on Current Initiatives. And now, to our guest.
Hello, this is Richard Jacobs with the Finding Genius Podcast, now part of the Finding Genius Foundation. I have David Getoff. He's a very interesting person. He's the author of Abundant Health in a Toxic World. He's a certified clinical nutritionist and traditional naturopath. He's an internationally recognized expert in nutrition, diet, and the use of nutritional supplements and detoxification. He has lectured and continues to lecture at dozens of scientific, medical, nutritional, dental, agricultural conferences across the U.S. Full disclosure, David is a member of my Finding Genius Foundation board, and there's a very good reason for that. I think he's really excellent when it comes to health and medicine. David himself, unfortunately, contracted acute myeloid leukemia a number of months ago, and he appears to have gotten himself out of it. And from what I understand, his doctors told him that 100% of the people that get it at his age die from it. So he's living proof of what he does. But welcome, David. Thanks for coming back.
My pleasure. Anytime I can help educate the public or anybody willing to know or wanting to learn, which is a small portion of the public, sadly, I am happy to do so.
Well, first question, just to really jump in, and since you know so much about health and nutrition, et cetera, I'm sure some people would say, well, if he knows so much, then why did he get acute myeloid leukemia? Was he doing something wrong? So would you address that first, please?
Sure. Well, it's interesting. You've got all sorts of different people we have in the world, and a number of my patients, I don't know what that number is, based on what has been said in a lot of cards that have been sent to me. It's higher than I thought. But a number of my patients are very religious in whatever their religions may be, and those people said, we put you in our prayers, and obviously you were meant to get this probably so you could experience what it's like to be in that position because your patients are, but you've never experienced it. Some people have said maybe it's because that way you will be more believed if you have gotten rid of something that you actually had. That's things people have said to me. As far as I'm concerned, it's very clear. Whether it's right or not, it's very clear. Most cancers, and leukemia and lymphoma specifically, but most cancers, one of the main causes, and in many cases the only cause, is a toxic load buildup of the body, we call body burden, that has gotten to the point that it is preventing the immune system from doing its job well enough. And although I specialize in detoxification, which I go over in my book, Abundant Health in a Toxic World, I do more detoxification, sadly, with my patients, only the ones that are really interested, than I have been doing over the last 30 years with myself. So, for example, I take a number of supplements which support detox, lipoic acid and dual tox from one company and ACZ nanozeolite from another company, a number of different things, and vitamin C and stuff like that, a number of things that support detox, including kidney support, liver support. However, the long-term patients of mine that go, anything you can do to make it less likely that I'm ever going to get a neurological disease, cancer, dementia, etc., I go, well, in that case, we need to do continual detoxification because you can't stop it from coming in. We live on a planet that has toxins everywhere. So with those people, they call me every time they've used up their last bottle of whichever detox agent I had them on. It might be called lawn and garden detox, sick building syndrome, solvent detox, Roundup detox. I've got maybe 40 or 50 of them, and some of them were made specifically for me. They call me up and they say, I've finished that bottle. Can I come in to be energetically tested for the next thing that my body wants to get rid of? And they'll come in every 3 months, 4 months, 5 months, and we'll test them for the next one, and we'll go through another bottle. And the things that are really poisonous to them or that they have a lot in their body, they have a very hard time even getting the dose up to where I want it to be. Now, they'll start at like 3 or 4 drops, and they feel so bad as it starts pulling stuff out, they have to go down to a half a drop or 1 drop.
Oh, wow.
I haven't been doing that with me. Okay, I've been doing all the other general things, kidney support, liver support, but as far as seeing what I should be pulling out next and switching those from bottle to bottle, that's something I haven't been doing. And I guess my body told me, excuse me, Mr. Getoff, but you've let the toxic load build up too much. There are lots of things we could give you. We're going to choose either the worst or one of the worst leukemias called acute myeloid.
I guess it's like the cobbler's son has no shoes, type thing.
Except that in general, I mean, I eat all organic. I eat grass-fed beef and grass-fed lamb and pasture-raised chickens and eggs, and I take 30 pills a day of supplements. It just wasn't enough detox. Whereas with the cobbler's shoes, cobbler's kids go barefoot, that's the cobbler not doing his job, or somebody saying, yeah, my husband's a plumber and the toilet leaks. No, if something in my house doesn't work, I fix it immediately. But that was just not quite enough.
Well, that's scary, though. I mean, it seems like you eat really well and you do a good job, probably compared to most people, and you still had this problem. So if you don't mind, what was it like when you first started getting sick? How did you notice?
For me, what I noticed was I started becoming out of breath and having less energy. I'd be walking from my office to my storeroom to grab supplements that I had to sell to the patient going out, and I would have to stop or walk more slowly, and as it got worse, I couldn't get to the storeroom, which is only 40 feet away, and I'd have to stop in the middle and catch my breath. And then as it got worse and I had to stop my practice to see what was going on, I ran a bunch of blood tests and found that most of the things we look at in our blood, red blood cells and hemoglobin and hematocrit and a whole bunch of different things, they weren't down somewhere in the range they're supposed to be. They weren't down a little bit below the range. They were way below the range. So, of course, my body wasn't carrying enough blood. It wasn't carrying enough oxygen, and so that's what happened. It got worse than that. I ended up passing out in the shower, luckily not killing myself or I wouldn't be here. At one point, I was looking at lab tests, had an appointment coming up with a hematologist to go in and have him take a look at stuff and discussion, but they were all busy, so it was way in the future. And so at one point, my wife saw me pass out, and she just decided, this is enough. I'm not waiting anymore. I'm not going to even ask him. As soon as I came back, she asked me a couple of questions. She said, you didn't give me coherent answers, and I called 911. That was the beginning over a period of months. I mean, I waited too long. I should have gone in for some additional stuff instead of just my testing. I should have really addressed it faster. But, I was busy doing all my other things, and so I would stop, every 10 feet, and I was going to run some more labs and see if it was getting better. And it was slowly getting worse, and I wasn't addressing it, which is not good. People need to address things, not as fast as most people do. Somebody gets a sore throat and they run to the doctor. Somebody gets a cold or a flu, and they run to the doctor. I was brought up by a mother who every time anybody ever got sick in our household at 89th Street Broadway in Manhattan, she wouldn't even consider allowing us to go to the doctor, who lived in our building, who was downstairs on the first floor. We could go into his office without even going out on the street. She said, it hasn't even been 7 days. You're not giving your body a chance yet. And so most of the time we never saw him because our body got well, as it does. But, if something is really, really bad and you're passing out and you can't walk 10 feet, that's a little bit more than a cold or a flu, which I've never gone to the doctor for a cold. I've never gone to the doctor for the flu. I almost never get them. Never gone to the doctor for a sore throat. I treat it myself and get rid of it. But this was worse, and I should have gone in, and I didn't. That was the beginning.
Okay. Well, it's good that your wife was there to kick you in the butt when you needed to, Yep. That's very good. What is acute myeloid leukemia, and what does it do to people typically?
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
Well, it prevents your cells in your spinal column from manufacturing what they're supposed to be manufacturing, and starts giving you incorrect cells. Body can't make enough, platelets. It can't make enough red blood cells and hemoglobin, and so I didn't check to see whether everybody gets the exact same symptoms that I got. I would expect that it would be maybe those or those and more. But that's what happened. Your body, your bone marrow basically is no longer manufacturing and doing the things it's supposed to, because it's been taken over by cancerous cells, by leukemia cells.
Right. And what did the doctors say? What was the prognosis? They said the chance of you surviving was what, 0?
Well, when I went in there, the first thing they started doing, and here I'm laying in a bed at Scripps Mercy in San Diego, and they're running all sorts of different tests on me, and the cardiologist was there, and the oncologist was there, and the oncologist came in and said, "We're fairly certain you have a specific type of cancer, but we can't be certain without doing a bone marrow biopsy. So we need to do that." And I said, "Okay, whatever you need to do to know what I have. You can't treat me, and maybe even I would have a better chance treating me if I knew what I had. I've been told that bone marrow biopsies are very painful." And she said, "Yeah, those are people that don't know what they're doing, do it wrong. No, don't worry about it." And I've had a lot of people tell me, "Oh yeah, my God, I had a bone marrow biopsy. It was so horrible, painful." She was right. The people there knew what they were doing, and there wasn't any pain at all. It wasn't even like there was a little. There was no pain. So they did the biopsy, and then they had to wait for the results. And she came into my room. I'm laying in bed. I was in the hospital for 29 days total. And she said, "You have acute myeloid leukemia, AML." And I don't remember whether she said it's the second worst or it's the worst form of leukemia. She said the things we can use, in other words, the agents we can use, the drugs we can use, and the prognosis that we have found varies based on age. She said, "You're 69. In this case, next month I'm going to be 70. I'm looking forward to collecting my top high, super high Social Security starting next month because I waited until 70. She said, in your case, anybody over 65, I think was the age she gave. Anybody over 65, we are restricted as to things that we can do. There are certain chemotherapy agents that would kill most of the people over 65. We can't use them. Bone marrow transplants would kill too many people over 65. I wouldn't have allowed that anyway because I've looked at the results, and bone marrow transplants, that would be another conversation, but I wouldn't have done that. But she said, because you're over, and I think it was 65, we can't do any of those. What I use with my myeloid leukemia patients are 2 drugs. One of them is decitabine. It's an infusion where you'll be sitting in an infusion center after you get out, because we can't do it inpatient. We're not allowed. But as soon as we get you out of here, you'll be going in every 3 or 4 weeks, and for 5 days in a row you'll get an infusion of Bacogen, which is decitabine, and you'll be taking tablets of something called Venclexta. And that's what I find is the best. I have been doing research on it. I know more about this than a lot of the other oncologists around the country, maybe around the world. And I said, "Well, what are what results can you tell me?" And she said, "Well, we get a response rate of 90 to 95%, whereas people that don't know what I know and they end up having people on drugs they shouldn't have on, and there's an interaction, get response rates of 65%. Now, the public doesn't understand that response rate has nothing to do with cure. It also has nothing to do with quality of life. So when my wife heard that, she thought that the woman had said, "I've got a 95% chance of beating the cancer." And she didn't realize until weeks afterwards that no, response rate only means that they can see a reduction in the number of the cancer cells. That's it. No correlation to life extension, no correlation to quality of life, no correlation to cure. And I knew that because I teach that. So I didn't say anything, didn't want to get my wife upset. But way later, when I was no longer in the hospital, and I'm now on these two drugs. I'm not now. I've stopped them, but I was on the drugs. We had a meeting with her, and I said, I need you to clarify something for my wife. She thought that you were saying 95% of the people in my category that you treat, you cure. And I told her that's not what the response rate is. Response rate has nothing to do with cure. And that you had told me that I had somewhere between 2 months and, if I was really, really lucky, 24 months to live, that nobody lives with this past that. And she said, you are correct. And my wife started crying, and she got very mad. She said, so you're misleading people when you use the terms response rate, and they think it means something else. She said, well, that's what we're taught to say. And, of course, that's true. That's what they're taught to say. So I was told that I had 2 months to 24 months, not to count on the 24 months, because that's like the luckiest people in the world get that much. Nobody lives longer than that. And, of course, I was told this in September. So we got October, November, December, January, February, March. I was told this 6 months ago. So I've got 6 months of that 24 months is already used up. But I feel fantastic, and we're going to go over some of that stuff. So that's you asked what my prognosis was. That's what it was.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
When you first heard what you had, what did you think? Like, uh-oh, or did you think, oh, well, or were you afraid?
No, because of my knowledge and the number of cancers I've turned around with lots and lots of people over my 30 years now of being in practice, I went, well, looks like I got a lot of work to do. That's really what I thought. As a matter of fact, I'll go a step further than that. After I got out of the hospital, after having had, I should go back to my records and count them, I'm not sure, somewhere between 12 and 20 blood transfusions and somewhere between 6 and 8 platelet infusions. But, after I got out of the hospital, one of my patients called me, it might have even been two, and asked me a very pointed, targeted question. They said, what did you do with all of the anxiety and depression from being told that if you're lucky, you're going to live 24 months and then you're dead? And I thought about it for a second. Since I'd never felt any anxiety and depression, I wanted to give a good answer. And I said, well, it's interesting. I understand your question, and I understand that lots of people would have a different answer than I do. But because I've turned this around in so many different people, I don't know if anybody's come to me with this exact leukemia, but I've turned so many different incurable diseases around. I wasn't the least bit worried. I knew that I was going to be able to see what additional supplements I needed, what additional detox I had to do, and I was not going to be one of their statistics. I was going to screw up all their statistics, and I was going to still live to be over 100, which has been my goal. And so I've never experienced any anxiety or any depression. And, the interesting part about all this is that anxiety and depression depress immune function, and that's been studied. If somebody really, really feels depressed or anxious, that depresses your immune system. Not having a number of people around you, or at least one that supports you and doesn't say, you're going to do what? You're going to take supplements? You're not going to be doing what the doctors say? I mean, if you've got the wrong people around you, they're not helping you by trying to convince you what they think you should be doing. They're actually hurting your immune system and making things worse. Luckily, the only person I've got around me besides Tomka, who's my 17-plus-year-old Tonkinese cat sitting in my lap right now, is my wife. And, we've been together for 41 years. She knows me. She's seen how many people I have helped and how many things I've reversed, and sometimes even in her massage clients and friends. And so she said, I feel bad with what they said your prognosis is, but if you're not worried, I'm not worried. I'll support you in whatever you want to do. And I therefore didn't have anybody yelling at me like many of my patients have and do, which is sad, that you're an idiot to follow this guy's advice. You should do exactly what your doctors say. I didn't have any of that, and that's a good thing that I didn't have that. So that's like a little side note.
Well, you mentioned that you are taking, or you were, some of the drugs that they gave you. So you turned down one procedure, but you also did take some of their pills. Why did you decide to do anything traditional? Why not just, okay, I know what to do. I've helped other people. I'm just going to go supplement and fix this myself.
Well, that's a good question. I let myself get too down way down, passing out, not being able to walk. Had to be in the hospital for a month, the beginning of which, I needed help to stand up and walk 10 feet to the bathroom in my private room in the oncology ward on the 8th floor. That got better and better, and then, the last couple of weeks, I just, walked there myself. I didn't even ring the buzzer for the nurse. I just, got up, disconnected myself from whatever they had me on, if it was oxygen or whatever, and walked into the bathroom. But there's no question that their transfusions and other things they were doing saved my life, and I accept that. Modern medicine does do some good things. I didn't have enough blood, I didn't have enough cells, and they gave me a bunch of transfusions. Really pissed me off that they don't ask people whether they've been vaccinated, and so I couldn't specify I only want transfusions from people that have not gotten all the toxic garbage from any COVID vaccines. I couldn't make that specification. So, some of that stuff is now in me, not injected, but, whatever some of the residues are. But, the oncologist, we had a very nice discussion. I like her a lot, Marin Feldman-Xavier. She's done a lot of work with these drugs, and she said these drugs have saved the lives of a number of her patients. She said she has people who went back to work after a few months. We don't know, it's not going to come back depending on their age group, but it kills the bad cells. And yes, I'll agree with you, Mr. Getoff, that it also kills a lot of the good cells. We know that. We can't do anything about it, but it kills the bad cells. And so I decided that, at the beginning, we'll see what happens. I will let her use those. She said that those two are not technically called chemotherapy, that especially because of my overall otherwise healthy body, I probably would get no side effects at all, and I didn't. Didn't lose any hair, didn't get nauseous, nothing at all. I mean, I ended up with a slight cough for a while, which went away when I stopped the drugs. I trusted the things she was saying, along with my, going back and forth with her and then grilling her on different stuff, that this, at least for a while, was going to do more benefits to my living and staying around so I could do my stuff afterwards than if I were to refuse it and, might allow myself to die because I wasn't letting her kill enough of the bad cells. Are you there?
What specific detoxes did you do?
What specific detoxes did I do? I take ACZ Nano, which is a zeolite, but I've been taking that for years. The only detoxes that I added was I started taking glutathione. There are a lot of companies that have it. Most of them I don't like, but, I carry the ones for my patients that I do like. So I started taking glutathione. And there's a company called Cellcore Biosciences, I believe. They have 4 or 5 detox products. And everything was based on muscle testing. Well, as soon as I got back into my house, I brought over one of the surrogates that I use, a person that I can test myself through, so to speak. If any of our listeners want to understand a little bit more about muscle testing so you know what it is and what it isn't, go to my website, davidgetoff.com will redirect you. Go to my website. All the way down the bottom, there's a photograph of me pressing on a woman's arm, even though that's not the way I do it. If you click on that, it will bring you to a 90-minute presentation I gave on muscle testing at a holistic cancer conference in San Diego. And after you've watched that, you'll know a lot more, because I'm not going to go into it all now. But I tested myself through a surrogate to decide what I needed to do, and a couple of supplements I was taking, I stopped. A couple of other supplements I added, which we can go over, some of the immune supplements. I brought in one of the Cellcore products at a very low dose. That's what my body wanted. A month or two later, it wanted a higher dose. A month later, it wanted a different one of their products. So the thing is that people want cookie-cutter medicine. That's what they teach in medical school. Everybody gets treated the same. If you have this problem, you get this product, and if you then die from the side effects of it, that was the one we're supposed to prescribe. Whereas if you're working with somebody that knows how to properly muscle test, which in my rough guesstimate is 10% or less of the people that are doing it, most of them don't know how to do it correctly, then you're getting things targeted to the best thing for you. And so although I will certainly answer when you ask me what are some of the immune-enhancing things I took. I mean, I will tell people. I'm not trying to hold anything back. I want people to understand that if I had 4 patients with the exact same condition, they might or might not test for some of the same things or totally different things for their immune system, because our bodies are different. We are the variable.
How long did it take for your doctor to start saying, wait a minute, how are you doing so well?
I think the time that she noticed that the most and had to say something, because it was in black and white in front of her, was at one point, and I might have to go look in my records. I'm trying to remember how long after the first bone marrow biopsy, because I said, how do you follow this? And she said, well, we'll have to do another bone marrow biopsy to see how many of the, what percentage of blast cells are still in you. You know, hopefully we're slowly killing them off with these chemicals. And I don't remember how many months it was that she said it's time for the second bone marrow biopsy. It might have been 2 months afterwards. It might have been 3 months afterwards. I mean, it's been quite a while. So I went in for a second bone marrow biopsy, and then we had a meeting with her. And she had the results there, and she said, we look at something called blasts. I still haven't looked them up to read more about exactly what blasts are. But she said your first biopsy showed 60% blasts, and the second one showed 4%. And I said, and again, in my age group, with what you're doing with me, it's how often do you see that kind of improvement? And she looked at my wife and I and said, never. I've never seen that before. She said, what your body is doing, it's the way it's benefiting and fighting this. I've never seen that before. So that's the first time that I knew and she knew.
Well, that's really cool. Did you do the I told you so dance, or were you more reserved about it?
No, I wanted her to be willing, which a lot of doctors are not, and I hear this from patients all the time. I wanted her to be willing to continue to allow me to be her patient, run tests on me that I wanted run or that she wanted run, and I didn't want an adversarial relationship where she thought I was being angry at her. So, there were discussions that we had, but they never got heated. In the hospital, I think the fourth day I was there, my wife was bringing me my dinner, so I didn't have to eat the crap that the hospital food serves. I tried one of their steaks once, and I spat it out. I couldn't chew that many times before something was swallowable. So their breakfasts I could deal with, because even though it wasn't the quality I would have had at home, they made a pretty good omelet with all the things I wanted in there. And although it wasn't raw grass-fed milk, they did have whole milk. I was afraid they'd only have 2%. And until my wife started bringing me my raw milk in a thermos, I would have that. But for dinner, my wife would bring me my food, and she'd bring me a little baggie with my 30 or 35 supplements. And I think it was the fourth day, one of the nurses was there as I was eating dinner, and my wife was handing me the pills with every few mouthfuls of food to slowly swallow the 30 or 35 pills. And the nurse said, you can't do that. And I don't know if it was my wife or me that said, we can't do what? I can't have dinner? No, you can't give him anything. And he's not allowed to receive a pill that isn't dispensed by us. And my wife said, I've been bringing these in every day. These are the same things he'd be taking at home. That may be, ma'am, but you can't do that. It has to be dispensed by us and approved by the pharmacist. She said, can I give him the rest of tonight? She said, yes, but I'm going to have the pharmacist come up here. So sometime in the next hour or two, their head pharmacist came into my room, very nice lady, and she said, it's our insurance. If somebody ends up having a side effect or some kind of interaction because of something that you give them that you don't realize interacts with something we're giving them, we are liable because it was given to them in the hospital. That's the reason we have to dispense all this stuff. And I said, well, if you want to give me all my pills, I have no problem with that. But, I'm the one that decides which pills. And she said, well, there are some pills that some substances that interact with our stuff. And I said, look, this is my specialty. Interactions of things with your drugs are most likely known better by me than they are by you. I said, let me give you an example.
Yeah.
If you have somebody on blood pressure medication, you will tell them you may not eat or drink any grapefruit or grapefruit juice. And she said, yeah, you're right. And I said, and you'll tell them that that's because it interacts with your drugs. And she says, that's correct. I said, well, that's what you've been told, but you've been misled. It doesn't interact with your drugs at all. What grapefruit and grapefruit juice do, because it's been studied, is it reduces the efficiency of the cytochrome P450 detoxification pathways, and therefore the body does not eliminate the blood pressure meds at the same speed that it would have had you not had that grapefruit. And so it builds up to a toxic level, and even though you're giving them what should be the proper amount for what you're treating, they're really getting much more than that because it's not being dispensed out of the body fast enough, and it could kill them. but you've been told it interacts. I could give you 2 or 3 other examples also. So I understand what does and doesn't interact. Trust me, nothing I'm taking will in any way do anything except support what we are all trying to do. Now, I understand most patients wouldn't have been able to go over this with her the way I did, but when she realized, and I told her what I do for a living and how many people I've, helped. I don't mean how many, I've never counted. But she ended up being very nice and said, I understand. We are still required to dispense them, so what I need you to do is have your wife bring in all the bottles, and one of the nurses will come in, and they will go over the bottles, they'll type them in, and you'll tell us whether this is 1 pill or 2 pills or 3 pills or a tablespoon or whatever. We'll write it down, and we will dispense them for you. She didn't ask me every single thing that I was taking. 1 or 2, she asked me about, and I explained them to her. And so I had no trouble continuing to take all of my stuff, but I understand somebody else might not have been able to get that result.
Yeah, no, that's amazing. That's really cool that you did that. And it's nice you did it in a way where it wasn't a fight and it wasn't adversarial,
It never helps. I'll call up a company to place an order for something. And, I'm giving them 15 products that I'm bringing in. And the woman on the phone will say, geez, I'm sorry, but such and such is on back order. We don't expect it in for 3 weeks. And I go, well, then ship everything else out, and I guess I'll get that as soon as you get it. And over and over again, I've had people say, I've never had anybody be so nice. Everybody jumps up and down. They're screaming, what do you mean it won't be in for 3 weeks? I need this terrific. And I go, well, tell me whether it's going to get it for me any faster if I'm nasty to you. You're trying to help me. And the person on the phone says, no, of course it won't. She said, as a matter of fact, I might pin a note on there, the person was nasty, and they'll hold yours longer than when it comes in. You won't be the first order filled. I said, exactly. So there's no purpose in doing something in a way that makes something that didn't have to be an argument into an argument. And I've had lots of places that I deal with say you are one of the nicest health practitioners we ever have to deal with on the phone.
Well, that's good. I guess it gets you a lot further, as you can see.
Yeah. Well, there's an old statement, I think, you get more bees with honey than with vinegar or something like that. And yeah, be nice to people. It's, and I call people up and they say, this is going to take me a couple of minutes to find out for you. And I go, I've got plenty of time. I would never call somebody if I don't have time. And they go, geez, I wish everybody else would be like that. They go, oh, I go, well, why are you calling somebody? You don't even know how long you're going to be on hold. If you're having somebody help you, be patient and don't call when you can't be patient. It just doesn't make sense. Plus, of course, it increases your stress level, which reduces your immune function.
So I don't know, did you learn any new lessons from going through this experience? Or was it just a reassertion, a reaffirmation of what you already know in terms of health?
Well, I learned how understaffed the hospitals were. This is a little disgusting, but I was told, because I was out of breath, I understand this, never to try and get out of bed to go to the restroom. I was in a private room. I had my own bathroom. It was, 10, 15 feet away. And so they had me connected to something for urination. So I never had to get out of bed. You just urinate, and it would be sucked up into this bag up on the wall. But, when I had to have a bowel movement, I had to get out of bed. And so, I would push the button as they instructed me to, the call button, and something comes up on some screen out at some nurse's station somewhere on the floor, and somebody's eventually gets on the speaker that I can hear in my room and says, what can we do for you? And I would have said, I need help getting to the bathroom. Well, of the first 3 or 4 times that happened, one of those times, nobody got into my room for 5, 6, 7 minutes, by which time I was already giving up on them, standing up, trying to get to the bathroom, and taking a crap on the floor because I couldn't wait any longer. And it was disgusting, and I hated it, and I was very angry. And so the next time somebody said, the nurses' shifts changed like every 8 hours. They said, remember, if you have to get out of bed, press this button. And I said, no way. Sorry, I'll press the button if I want something from you, but if it's because I have to go to the bathroom, I'm not pressing the button. I've already crapped on the floor here once because of how long it took. Oh, well, I will watch your stuff, and I'll have them tell me immediately. That won't happen to me. So I believed that particular nurse, and one more time I pressed the button, and one more time I went on the floor because of how long it took. And that was the last. I said, forget this. She said, we could bring in a porta potty that goes right next to the bed so you can get to it easily. And that's what I did until I had enough strength to just disconnect myself and walk into the bathroom. So, I got to experience the problems that hospitals have. I'm not their only patient. I understand that. Just don't tell me I have to do this, I have to do that. and I got to see it firsthand. And I got to see firsthand what my patients have told me, where they wanted to bring their dad the supplements I had him on, or their mom or their grandmother or their sister or their brother, and they said, you can't give them those. And now I understand that the answer to you can't give them those is not to get angry. It's to say, these are the supplements that the nutrition expert I'm working with says my whoever it is, mother, dad, sister, whatever, need to be on all the time. He has told me that they will not interact with any of your drugs. Who do we need to speak to get them approved? Again, you have to be nice. Now, I don't know if there are some doctors out there that would be, I don't know what, bitches and bastards, whatever word somebody wants to use, and would say, I'm sorry, we don't allow anything to be given. But obviously that's not true. I mean, I'm a very good example of it's not true. They don't allow anything to be given. They have to dispense it, and maybe the pharmacist needs to look at it and make sure it's not something that they believe interact. But if you're nice, you might get the results you want. So I learned that, which is pretty important. Anything else I learned when I was there? I learned that they have music therapy. Somebody asked me would I like music therapy. I said, I don't know. I've never heard of it. She said, well, we have a music therapist that goes around different days during the week and plays music for you in your room. I said, sounds fascinating. I love live music, of course.
As long as it's not a harp, you'd be okay.
Yeah. So a couple of days later, a woman comes in with a little portable guitar and a little amplifier and a chair. And she said, I'll be your music therapist today. What type of music do you like? I said, folk. And I rattled off a whole bunch of different names, Peter, Paul, and Mary, John Denver, Judy Collins, Joni Mitchell, et cetera, et cetera. And she picked a song and sang it, and I started singing it with her. And we picked another one, and we sang it together, and a third one, we sang it together. And I said, I got a question for you. How many times when you're playing this for somebody do they sing it with you? I got the same answer that I got with the biopsies. Never. She said, and I said, why? She said, they're in worse condition than you. They don't sing, and they can't. They're just listening. So I had her come back as many times as she was able, which was like every, at least once a week. And that was nice. I didn't know there was such a thing. So I learned that.
That's cool. Yeah. Well, I mean, in terms of how you help your current patients and how you work with your own health, did anything change after this experience?
No, not really. All the things that I do are based on either science or a combination of science and muscle testing to make it specific for that patient. It was interesting muscle testing through a surrogate to see what things I needed to be on, because I was already taking 30 to 35 pills a day, but now I had to test a whole bunch of different immune products, a whole bunch of different mushrooms, a whole bunch of different herbs. There's a very interesting field of science called hormesis, Hormesis, hormesis. And hormesis is also used in radiation. I'm not sure if I should even call it therapy, but there are hormesis stones sold by only one company in the world, as far as I know, Nighthawk Minerals. And they had told me, and I carried some of them, that if you have cancer, sometimes wearing one of these slightly radioactive stones that isn't even more radioactive than certain parts of our planet where people live, that it triggers the body to have its immune system work harder because of sensing to work against the radioactivity. So I tested myself, should I be wearing a hormesis stone? And I got a yes answer. So I pulled out about 20 different levels of hormesis stones and tested them all, and I'm still wearing right now today, as I talk to you, the one that I test for. But it's just interesting. I didn't learn any new products. I mean, I'm always looking for products. I'll never stop. If somebody contacts me and says, our stuff is the best, I know it isn't, because everybody is told to say their stuff is the best, or maybe believes it. But I will always say, look, you're the rep for this company. You would love me to carry your products. That's your job. I understand that. This is how I work. If you can't work that way, they'll never get into my office. If you are willing to send me little test vials or a single tablet or a single capsule in a little baggie labeled so I know what they are and what they are for, then I will test 20 or 30 patients over the next 3 or 4 months who would normally benefit by that type of product, and I will make sure that in addition to the 1 or 2 or 5 or 10 or 15 products that I have for that category, I will test yours also. And if one single patient ever tests better for your product than the ones that I've discovered and now use over the last 3 decades, then I will order them and keep them here because I always want the best for everybody. And most companies say no problem. Some send me full bottles, some send me a capsule or two, and that's how I decide what I'm going to put somebody on and whether or not a new product is something that's good. So like when some health practitioner, a dentist actually, that I had taught, I teach for the American College of Integrative Medicine and Dentistry, which is a private college in New York that certifies dentists to be holistic naturopathic dentists. And I teach the nutrition portion of their 14-month program. They fly me in twice a year. And one of the dentists emailed me one day and said, "Are you familiar with Cellcore?" I think it's Cellcore Biosciences. And I said, "No." And she said, "Their products seem really, really good. I'd like your opinion." And so I called them up, told them who I was. They sent me a muscle test kit, and I found about 5 of their products, of their maybe 30 or 40 products, that I now carry. And I'm on one of them. My wife is on one of them. Those are the detox products. And some people won't test for them. But again, that's how I decide what I'm going to do with somebody, and it's very specific to the person.
Yeah, can we talk about detox for a brief period of time? When patients come to you, how do you tell what's ailing them in terms of detox needs?
Well, the first thing, everybody gets tested for which kidney and which liver support product their body wants to use. Because when we detox, there are only a few different ways that we can release poisons. We can release them through our breath as we breathe. We can release them through our skin as we sweat. We can release them through our urine and our stool. But most of those are going through and being processed by our liver and our kidneys, unless somebody only has one kidney. Then it's their kidney instead of kidneys. And so before I can do any other detox, I've got to get their kidneys and their liver working well enough, because that, in effect, is detoxing those organs and preparing them for any other detox I do so it doesn't further overload their body. So everybody goes on kidney and liver support. Usually a second appointment is in 2 months, and most often by 2 months, not always, but most often by 2 months, we've gotten enough kidney and liver support that I can then test them for a bunch of detox agents, of which I've got, 40 or 50, and see which ones their body can now handle, and we start pulling out other poisons. And there's, all sorts of different things. People have to drink adequate water. They don't have to go nuts, but they have to drink adequate water. How much is that? It depends on their diet. I drink 10 quarts a week of raw, grass-fed, double-fat whole milk. And in that product, my body can use the water very easily out of that product because it's raw and hasn't been processed or, pasteurized, homogenized. So I don't need to drink as much water as other people. I'm getting a bunch from that. But most people would do best with somewhere between a quart, which is about a liter, and 2 quarts a day, unless they're sweating. If they're sweating, if they're doing exercise, then it goes up and they have to do more. And it's actually interesting because, I look back not too many months ago when I couldn't walk 10 feet, and my brother decided to fly in and visit me because he wanted to make sure he got to see me in case I did die. He said, "I'm not flying anywhere during this COVID nonsense. Forget about it." But he said, "For you, I want to come in and visit you." So he flew in from Florida, and he was in the U.S. Open for pickleball in his age group, and he told me all about pickleball that I'd never heard of. So I tried when he flew in. I was, sort of in between healthy, where I am now, and horrible, where I was at the beginning. And so he played pickleball with one of my wife's clients and said, "Why don't you come try?" And I said, "I don't know, but I'll give it a try." And I, did very, very little, and then was out of breath and had to sit down. But it was fun enough that I decided to take it up, and I now play pickleball once a week. And I played pickleball on Monday for 2 straight hours and never had a problem because this is the new body that I've developed.
Yeah, that's awesome.
Yeah, very, very different. That I now I'm in so much better shape. It's absolutely amazing. But
how long did it take you to get to the point where you were 100% feeling good for like yourself?
Well, I was released from the hospital after 29 days, and my first day in the hospital was either the last or second to last day of August. So basically September 1st, sort of. I think it was August 30th, 31st. That was when I was discharged, and I noticed beautiful improvements. As the weeks went by, I got to the point that, and these are silly little things, but I had to sit down to urinate because I didn't have the strength to stand up. Women sit down, men stand up. I couldn't. And after I'd been home for a couple of weeks and was slowly recovering better and better, all of a sudden one day I walked into the bathroom and I'm, using the bathroom, and I realized I was standing up, and I went, "Oh my God, That's the first time I've been able to stand up and urinate in, months. And it just slowly got better and better and better. And there were larger improvements for the first month and a half. And there was a physical therapist that would come over here, and he said, I've never seen anybody with the kind of improvements that you show me. He said, this is not what we normally see. And then the nurse that came over from home health said, I'm not sure what I'm doing here. You're in so much better shape than anybody. I visit people, they're in their bed on IVs. You're walking around the house and talking like a healthy person. I understand you can't run up the block. Of course, now I could. But your question was, how long did it take before I felt 100% totally normal, even if some of my labs weren't? That would be somewhere between, that would be right around 3 weeks ago. So people can calculate that based on the dates I gave them.
That's amazing. So under 6 months, huh?
Yep, which is very, very nice. And I just now, about a week and a half ago, stopped all of my medications. So the 2 medications they had me on, where I was going to an infusion center in the hospital, first every 4 weeks, then as I got much, much better, every 5 weeks, and just sitting there for an hour while they put this decitabine, Bacogen, into my vein for 5 days in a row, every 4 weeks, and then as I was better, every 5 weeks. The last one I got of those was a couple of weeks ago, and then I emailed the oncologist and said, I'm at that point now, it's time to stop everything. There's no sense in scheduling my next infusions 5 weeks from now because I feel fine. And she said, okay, well, you told me that you were going to do that, so let's stop everything. So I stopped taking my pills, and I stopped the infusions, and so now I'm just on my stuff.
Yeah, that's amazing. I mean, so I guess you're the only patient of this oncologist that recovered this completely, or what did she say?
Yeah, she's never seen this rate of recovery. Obviously, I haven't reached her 2-year mark. So when I told her, I intend to live to be over 100, and I still remember her email answer because it was so cute. She said, I am the forever optimist. I hope you were correct, but we've never seen that. It always comes back. And of course, that's because, and people need to understand this. The reason cancer pretty much, with very few exceptions, always comes back, unless the person dies of a car accident before they get the cancer back, is because your immune system was not working well enough to prevent you from getting cancer. Okay, that's a given if the person has cancer. Now, all of the things that you were or weren't doing that made it so your system wasn't working well enough to prevent it, those don't generally get changed in people unless they come and work with somebody good, me or a bunch of other different people. I mean, I'm sure as hell not the only person out there that works with people. But unless they make some major enough changes that had they been doing their life that way before, they wouldn't have gotten the cancer, unless those are the kind of changes, which includes supplements and which includes, eating mostly or totally organic and cutting out the things that are or become sugar, which is 3 categories: sugars, starches, and alcohol. Since they haven't made those changes, of course the cancer is going to come back, because the only changes that have been made to their immune system are the things that depressed it even further, which are the toxic drugs that were necessary to try and turn it around a little bit and save their life, but they killed more healthy cells than they did cancer cells. And so although they may have saved their life temporarily, they've increased the likelihood of them getting cancer, and that's the reason almost everybody gets their cancer back in the next 2 or 3 years, sometimes faster than that. And it's the reason that the medical profession decided if we ever want to be able to say we've cured anybody and not look totally stupid, we have to pick a time that isn't too long, because if we say you have to die and not die of the cancer, that's not good enough. Everybody's going to die of the cancer. If we said 10 years, that's not good enough. Almost every single person that's ever had cancer and we gotten rid of it with them or pulled it out with surgery, they're going to have it back. So they chose 5 years, a bunch of years ago, and what they do is they follow people that have ever been diagnosed with cancer. And on the date of your 5th year anniversary, if you don't believe you have cancer, if the doctor doesn't say you have cancer, they're not still treating you for it, you get put into the cured statistic. But what's sad, because it's an out-and-out down route lie, is that if the next week you start feeling pain somewhere, you go into the doctor and the doctor says, ooh, that's in the area that you had your cancer, or wherever it is, we better do a PET scan, or we better do an MRI. And so they do a scan, and they go, I hate to tell you this, Mr. So-and-so, Mrs. So-and-so, whatever, but there's 25 cancer tumors in your body, and I guess they just got large enough that you could feel them. Doctor, how long, based on what you just saw in there, how long do you think they've been there? Based on how many there are, 2.5 years, 3 years. So you've been put into the cured category because at the 5-year mark, they thought you were still cured. And 5 years and a week, or a day, or whatever, an hour, you find out you are filled with metastases everywhere. They don't pull you out of the cured statistic, because if they did that, they'd have almost none there. And so they need to be able to lie to the public. And it's really disgusting. I don't know what
I've seen 5-year survival rates for cancers. So what does that tell you? If you translate that to real data, or real data, what does that mean?
Well, that's accurate, because if somebody is surviving, they're alive. So if you've got 1,000 people that had cancer 5 years ago, and I'm going to make these figures up. These are not coming out of any study. And out of those thousand people that had cancer diagnosed 5 years ago, 500 of them are in horrible condition in the hospital dying of cancer, and they'll probably be dead within the next couple of months. And of the remaining 500, some are being treated again, and they still, they've got their cancer. But maybe there's only 5 that are actually cancer-free. That's still 1,000 people that have survived 5 years. It's not telling you what condition they're in. So you have to be careful and understand the wording that's being used, or we get lied to.
How do you get data on what percentage of people actually go into remission or get to the point where they just don't get cancer back? How long would it take for you to say, or someone to say, all right, the cancer is really gone? 5 years, 10 years, 20 years?
Well, as far as medicine is concerned, medicine, they want 5 years. After 5 years, if you're clear, even though they may not realize you're not clear, they're going to say you're cured. But depending on the type of cancer, that would vary the type of test that they would have to do. See, it's very, very interesting. If you have a condition, let's take the flu or strep throat. I mean, I could pick anything, but I'll pick those two. And 2 weeks from now, after either drinking good water, getting enough rest, and taking a lot of vitamin C and vitamin A, it's gone. Or with somebody else, it's on antibiotics, whatever it may be. After 2 weeks, you're well. You're considered cured. And if the next year you get that exact same strep throat, or that same staph infection, or that same flu again, no doctor on the planet Earth will say, yeah, it came back. You didn't get rid of it, it came back. They'll never say that. They only say that with cancer to save face, because it didn't come back. That's a lie. It didn't come back in the same way that the flu didn't come back, and your cold didn't come back, and your sore throat didn't come back. Nobody would say that. They said, yeah, I got another sore throat. Damn it, I got the flu 3 years in a row. Nobody would ever say it came back. But they're trying to save face. They need to be able to say not that what they did didn't work. So if they say it came back, then that's on you. We didn't get all of it. It was still there. It came back, as opposed to, it was cured. It's to me, it's their way of misrepresenting what's really going on.
Interesting. So, what would you call it when someone actually gets rid of a certain disease or condition versus what's happening normally or naturally, or those words don't even serve, but what's typically happening versus what your description of what's happening?
Well, if the condition is gone and the person feels totally normal and there isn't a single currently available lab test that can show that that condition in any way, shape, or form is still there, then whether it was medicine, their body, or a combination of both, they've been cured. Very, very simple. They've been cured. And if they get it again, it's not because it came back. It's because they got it again, because their body still wasn't able to prevent it from happening.
Well, if there's a particular kind of cancer, and some people after, let's say, 5, 6, 7, 8 years, they feel totally fine. They show no symptoms of any problems or anything. Have they actually gotten rid of the cancer, or what do you think has happened to those people?
If they feel totally fine and every single test that medicine can do, which varies depending on the type of cancer, shows that they are cancer-free, then they've gotten rid of the cancer. But very likely because and then one of the ways that medicine will say, well, no, the reason we know it came back is because it's still breast cancer, or because it's still prostate cancer, or because it's still whatever cancer. And well, yeah, but you see, that was your body's weak cellular point. So that's the kind of cancer you got. So yeah, it's still your weak cellular point, so the same type came back. And maybe it looks the same in their testing and microscope, but that doesn't mean you weren't cured before. It just
So
means
if
you
someone
didn't
has
do
a
enough of the
particular,
right things afterwards.
if someone has a particular kind of cancer, I'm pretty sure I know your answer. Traditional medicine. So let's say someone went to another naturopath or another functional medicine doctor, and they had thyroid cancer, and it was 7 years ago, and they feel fine, and they're just going to this doctor, and they just want to feel good and be in good shape and detox and all that stuff. Would a typical practitioner say, "Oh, okay, because you had thyroid cancer, we're going to put you on this kind of detox"? And would you instead say, "Well, doesn't matter what happened in the past, we're just still going to test because we don't know what the current situation is. And just because this happened in the past, the thyroid cancer doesn't mean that you should have these supplements or these detoxes. It doesn't necessarily correlate." Is that accurate?
That's correct. Yeah, that's correct. Medicine might do that. Somebody that works the way I work treats the whole person, not some condition that they had.
Okay. All right. I gotcha.
And of course, there are a lot of things that people can do to reduce their risks of getting neurological diseases, autoimmune diseases, and cancer. That's the big conglomeration of things that all of the things we do wrong increases your risk of. But a lot of people aren't willing. And, here I'm a good example of somebody that did almost all of them except one, and I ended up with cancer. But that, again, that's just I'm in research studies that would be called an N of 1. But there's no wireless in my house. There's no wireless in my office. Everything is hardwired. I had an electrician run cables from where the internet comes in. All my phone lines are hardwired. I don't have wireless in my house because, unlike the public who gets their information from the media, I go to the scientists. So I went to the International Electromagnetic Field Conference and listened to the scientists going over the research from the last 40 years that they've done, showing how toxic Wi-Fi is, how toxic cell phones are, how toxic cordless phones are, and all of the published research that none of the media brings to us. And I take some of that and some of their presentations that I liked by some of the good scientists, and I put it in the wireless section of my website. So if somebody says there isn't any research, they can go listen to some of the scientists. But even though I've done all that, the difference might be that had I not, had I lived with Wi-Fi, which I never have, had I lived with cordless phones, which I never have, I don't even use a cell phone. I own one. It's turned off in my glove compartment of my car. When I go out of town, I take it with me on a charger. And, at the end of the day, I go back into my room, find where I stuck my cell phone, which I did not carry around with me, even though everybody else is. So, yeah, theirs are bothering me, but, mine isn't. Everything you can do is a help. And I turn it on, walk around my entire room to find the best signal. If I don't get any place where I can get pretty much all the bars lit, then I may go downstairs and walk outside. Because what people aren't told, although the information is out there, is that your cell phone is a computer, and it puts out a stronger and stronger and stronger, as it gets stronger, it's more dangerous, signal based on how close you are to the nearest cell tower. So if you have 2 bars and you're on a phone call, it's much more damaging to your body than if you have 5 bars. If they're all lit, it puts out a lot less signal because it's conserving battery strength. So all sorts of little things. And I've done all of that, and I still get cancer. And somebody will say, look at that. You did everything. You still got cancer. Why should I bother? That's a very poor idea. That's like driving down the road someplace, and you happen to see 3 or 4 people who are running tires that are almost bald. And you go, yeah, why should I replace my tires? They're not. Because the next time you hit a little bit of water and skid, you're going to have an accident and die.
Yeah, I'm probably a common example, like when when you're feeling good or when you're feeling okay, everything's fine, you don't want to worry about anything. And then, if you get really sick or something bad happens, all of a sudden you're like, oh, okay, I got to fix this. But just naturally over time, you stop worrying, you stop thinking, oh no, there's imminent problems, and you go back to the way you were and you forget. It seems like that's what happens with everybody.
Well, again, it depends. It always depends on knowledge level as well as your, and I'll give it a word, fanaticism to be able to do or be whatever it is you're trying to be. I looked when I went online after I got home and started searching leukemia. I found a research study that showed that a study was done that the people that were drinking depleted deuterium water lived longer than the people that were drinking regular water. Okay, I know what depleted deuterium water is. I'd seen some lectures on it. Very expensive. I added it in. I looked at all the different ones. I found the one that's the best of all, which is called light, L-I-T-E, light water. And I now drink 16 ounces of light water every day. I squeeze a half of a lemon into it, into a glass, and then I take the light water and it goes into my refrigerator. When it's really cold, it goes into something called the Dolphin. The Dolphin is a seltzer maker made by SodaStream, and I make it into depleted deuterium seltzer water, and I add 10 drops of Stevia brand stevia, and then I pour in the seltzer, and I have a delicious carbonated lemonade. But I wouldn't have done that otherwise. Deuterium water, deuterium water is very expensive. But here's a research study published, well done, showing that adding that in, and people can go and read about deuterium, that adding that in to reduce your deuterium level was not just extending the life of all sorts of animals, but it was helping people with leukemia. I said, okay, I'll add it. I mean, everybody gets to decide what they want to add into what they're doing. Up to them.
Yeah. Last question, and then I want to ask people how they can reach you. I've recently been interviewing people on microplastics. What are the pollutants or toxins that people will get, really, no matter what they do? Do they include microplastics? Like, what have you seen that is getting into people that, just by living, walking around and existing and driving places, and working in offices, they're getting?
I think the best thing for people to do, because it's an eye-opener to read this. There's a big non-profit group called EWG.org. It's the Environmental Working Group. And back in 2003, I believe, they funded a very, very important study called Body Burden, the Pollution in People. And they couldn't find a lab to test for the hundreds of different poisons they wanted to test for, because none of them test for all of them. Every single poison has a different type of test that has to be done. So they contracted with labs around the world to be able to test for all the things that they wanted to test for. Then they got, I believe it was 12 people, and they took fat biopsies, because most of us store poisons predominantly in our fat cells, and they divided each one up into the number of labs that they had and sent them out to all these labs around the world to identify all the poisons they could. And they wrote this whole thing up on all the different poisons. Everybody had, I'm not sure if my memory is right on this, I think everybody had at least 68 different poisons in them, which included things like DDT that had been outlawed decades before. They were still there. And when somebody says, well, come on, what's really in us? I say you need to read Body Burden, the Pollution in People. And if that gets you really interested after you've read it, then you need to read their next study that came out 5 years later called Body Burden, the Pollution in Newborns, because they wanted to see how many pollutants were in the fetus before it was even born coming in from mom. So they collected umbilical cords and they analyzed those. Another fantastic study. It's a little hard to find on their website. I asked them once, could I put them both on my website? They said, no, it's copyrighted. So if you can't find the full study, not a little, disclosure of it or something, if you can't find the full study for Body Burden, the Pollution in People, or Body Burden, the Pollution in Newborns, call up EWG. Their number is there on their website, ewg.org, and say you'd really like to read those. Can you either give me a link to them or send them to me so I can read them? And they will. And I'm going to try again and see if they can let me put them on my site.
Yeah, I read the two papers, and I couldn't believe that there was, hundreds of different chemicals in cord blood that affect, babies before they're even born, and it's insane.
It's really insane.
Really crazy.
Yeah.
Well, very good, Dave. There's a ton more I could ask you, but we're going long here. From what I saw, your practice was closed because you were taking care of your own health, but it's going to be reopening, I believe, in May. Is that right?
As a matter of fact, May is almost full already, with patients calling me up and saying, I hear you're taking appointments in May. I want one. So I think I've probably got 3 or 4 left in May, and then it'll be June. But yes, I'm taking appointments in May. The best way to get in touch with me is either to call me on my public phone number, which is on my website, but it's 619-441-8700. And my policy is I work Tuesday through Saturday. Tuesday from 10 to 6 and Saturday from 10 to 5. If I'm in my office, or actually my home, because my home is licensed as a business, so it's just one building. If I'm here and I'm not on the phone, and I'm not busy with a patient sitting here, and that phone rings, I pick it up. Sometimes a patient that I've had for 6 months, I pick up the phone, they go, oh my God, really? I didn't think you ever answered your phone. They don't understand. If I'm not on another call and I don't have a patient here, I will always pick up the phone. It's one less call to return, for crying out loud. So, that's one way to get me. But I won't take a lot of time with somebody on the phone because, I'm not making any money. I'll answer a couple questions. If somebody wants to know what it would take to get in to see me, they first have to go to my website. Up on the top, there's a bunch of words that go across it. You want to click on the one that says Initial Consultation, and two things pop up. Very simple. An audio file of me talking about the initial consultation. You got to listen to that whole thing. I think it's 15 minutes. And then after that, you have to read all the text that's underneath it because that's not a duplication. That's additional information I didn't put in the audio. And after you've done all that, now you know all the things that I need you to know before I see you. And then you can call up and say, I listened, I read all the stuff in the text, I'd like to schedule an initial consultation. If somebody calls me up and said, yeah, I did all that, what do you charge? I go, you didn't do all that, or you wouldn't be asking me that question, go do it. Yeah. Or I did all that, how long is your consultation? You didn't do it. I'm trying to save myself time. If they want to email me, but I don't know how much time I always have to get emails back to people, they can email me through my website. The email address, direct email address is naturopath, so that's NATURO, P as in Paul, ATH, the numeral 4, YOU, @gmail.com. And, sometimes I get a lot of emails, sometimes I get a few. If somebody asks me zillions of questions, I'm not going to answer them all. You're not my patient. I'm not making any money on that, and I got other things to do. I'm busy. But those are the two ways to get me.
Makes sense. Well, very good. David, it was great to speak to you again, and thank you so much for coming on the podcast.
Oh, you're welcome. And actually, I'll give you one piece of information because I just determined it, and people need to know it. For years and years and years and years, my favorite multivitamin company has been Super Nutrition in California. And they decided, the woman that owned it decided it was time to retire. It was too much work. She sold it to a company to continue it. They decided not to continue it. They sold it to another company that isn't a manufacturer. They sold it to iHerb. iHerb doesn't manufacture anything. iHerb just resells stuff. So now all of a sudden they're putting a formula together and having somebody manufacture it. And when I tested it, it didn't test as well as the old formula, which is not surprising because Super Nutrition was a nut about finding the exact quality of every one of the hundreds of ingredients in there and retesting them no matter what the manufacturer said and refusing many of them and everything. And iHerb is not a manufacturer. So I no longer recommend Super Nutrition's products since they're now being sold and made by iHerb. So I've been taking the last month and a half trying to find another multivitamin. It won't be right for everybody. We're all different. We are the variable, as I said earlier. But I wanted to find another really, really good high-potency multivitamin, and I just finally did.
Very good.
A week ago, and it's the Ultra Preventive X from Douglas Laboratories. And in tablets, it's 2 twice a day with meals, and in capsules, it's 4 twice a day with meals.
Very good.
And, just want to let people know that because a lot of people listening
to you.
Well,
David, again, thank you for all your wisdom.
You're very welcome.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.